A very good afternoon, everyone. Thank you for joining us for our webinar today. My name is Zhihan, a research associate from SSR. Today, we are honored to have Dr. Harry Tan, Ms. Janine Teo, Ms. Francesca Lee, and Ms. Rachel Ng from the Institute of Policy Studies present their research on housing the homeless during COVID-19 in Singapore. We have also invited Ms. Lilian Ong, Director of Social Work from New Hope Community Services, to moderate this webinar. Before I hand over my time to the presenters, I will first make a few housekeeping announcements. We are recording this webinar on Zoom, and the content from this recording may be used for SSR's publicity in the future. In addition, this webinar is not open to media reporting. For any media inquiries, please direct them to me at my email address on this slide. By participating in this webinar, you consent to these conditions. For the Q&A session later, we will accept questions in two ways. First, you may vote and post for questions via our Poll Everywhere link, which I will share on the Zoom chat later. Alternatively, if you wish to ask your question directly, you may use the virtual raise hand function and unmute your microphone after being called by the moderator. As we have a limited amount of time, we apologize if we are unable to address all questions. On behalf of New Hope Community Services and IPS, we would like to highlight the Homelessness Learning Forum that will be held on the 10th of October. The forum this year aims to bring together social service professionals, partners, and individuals passionate about making a difference in the lives of the homeless community and explore how the shelter system in Singapore can be improved to cope with their differing needs. Please scan the QR code on the screen to find out more about this event. So with that, I will now pass my time over to Harry for the presentation. Thank you.
Thank you, Zihan. Good afternoon, everyone. I'm Harry, and I will be co-presenting with my colleagues from IPS today. Our presentation is titled Housing the Homeless During the COVID-19 Pandemic in Singapore. The findings from this presentation draws actually from phase 1 of an ongoing study that we are doing on long-term homelessness in Singapore. So before we start, we would like to thank MSF and the following community organizations, New Hope Community Services, AWA, Ang Mo Kio FSC, who are all very instrumental to getting us to this point. Next slide, please. So this slide, on this slide, you'll see an outline of our presentation today. I'll bring us very quickly through a quick background on homelessness in Singapore, and then tell you a little bit about the overview of our study and our methodology before handing it over to Janine to elaborate on the profiles of our participants and, more importantly, to talk about shelter provision during the pandemic. After Janine, Francesca will explain to all of us the pathways through homelessness that we have developed, and Rachel will then take us through the experiences of shelter living. After that, I will come back again to wrap up with some policy recommendations. So let me begin by commenting about homelessness in Singapore. I think any discussion about homelessness in Singapore these days actually must take into consideration the various nationwide street counts that most of us would have been familiar by now. So the first two nationwide homelessness street counts were conducted by Dr. Ng Kok Ho from Lee Kuan Yew School of Public Policy, NUS. The 2019 count actually found approximately 1,000 rough sleepers on a single night. And the 2021 count conducted during the pandemic found 616 rough sleepers on a single night. And then late last year in 2022, MSF conducted another nationwide street count to update these numbers and also to update the geographical spread of the rough sleepers after the ceasing of COVID-19 safe measurement measures and the border closures. So MSF found quite similar, about 530 street homeless people on a single night count. So what's the key takeaway? The key takeaway from these counts and how it relates to our presentation today is actually this, that first, there is a decrease of about 40% in terms of rough sleepers during the pandemic. And then second, there is a corresponding increase in shelter uptake figures from 65 to 420 over those 2 years. These numbers reflect the effects of the pandemic on homelessness, particularly the shift from street to sheltered homelessness. My colleagues will discuss these effects further. Next slide, please. Janine, can we go back to the slide? Sorry. Yeah, so let me deal with the second point on this slide as well. So legally, actually, rough sleeping in Singapore is actually not illegal, contrary to what some of us might assume. So, but like countries in the West, Singapore has put in place laws to regulate disorderly or public nuisance behaviors, such as public drinking or public drunkenness, to be more precise, trespassing, begging, that might be associated with some rough sleepers. Our country also has a law called the Destitute Persons Act, which allows authorities to admit those deemed as destitute to welfare homes for compulsory institutionalization, for compulsory institutional care and rehabilitation. Lastly, local research has shown that the common reasons for homelessness in Singapore included economic ones, such as intergenerational poverty, family breakdowns, housing insecurity, and poor physical and mental health issues. During the pandemic, the breakdown of cross-border living, as we will show later, was a key reason that contributed to people's homelessness. All right, next slide, please. So how is Singapore tackling homelessness? I think in recent years, the government has led the shift towards a whole-of-society approach to tackle homelessness. A prime example of this approach is the Partners Engaging and Empowering Rough Sleepers Network, the PS network, that was launched formally in 2019. The network itself is a collaboration among community partners, social service agencies, and public agencies to engage and support rough sleepers and homeless persons, focusing on two things. I think the first one is on befriending and assisting rough sleepers on the streets, and then the second focus is to provide different shelter options to homeless people. As you will hear later, one of the key initiatives that emerged around the pandemic in Singapore is the temporary night shelters called Safe Sound Sleeping Places, S3Ps for short. Homelessness, particularly the rough sleeping, became even more apparent during the pandemic. So in April 2020, the circuit breaker was implemented and people were advised to only leave their homes for essential purposes. This lasted for 3 months. As I mentioned earlier, when we consider homelessness in relation to the COVID-19 pandemic, we see a trend of homeless people being more receptive to go into shelters or to go into the shelter system. This trend actually was not unique to Singapore, but occurred in many countries around the world, such as Australia, US, UK, Japan, and so on. In the local context, however, this was most prominent during the circuit breaker from April to June 2020. During this period, rough sleepers were fast-tracked into shelters with the help of the volunteers in the PS network. How does this look like on the ground? On the ground, outreach volunteers actually partnered with community organizations and government agencies to make this happen. By the end of 2021, almost 1,000 people received temporary shelter support. We'll continue this story later in our presentation. For now, let me jump quickly to give you an overview of our study and our methodology. Our presentation today, as I said, is based on findings from phase 1 of an ongoing study that we are doing on long-term homelessness. So homelessness in our study actually refers to individuals or families who sleep in public spaces or who are unable to provide housing security for themselves and have no access to adequate secure housing provided by their families or the government. So actually, when we embark on phase 1, it was right smack in the middle of the pandemic. As such, I think our team felt that it was important that our research questions also focus on profiling the homeless during the pandemic, their pathways into homelessness, and their experiences in homelessness shelter or in homeless shelter. To answer these questions, actually, our team conducted semi-structured qualitative, So to answer these research questions that we wanted to embark on, we actually conducted semi-structured qualitative interviews with 50 participants admitted into transitional shelters or S3Ps in 2020 and 2021. And those 2 years, again, were during the COVID-19 pandemic as well. So the semi-structured qualitative interview format actually gave us the flexibility to actually delve deeper into certain issues that are surfaced by our participants. This was really very important because it allows us to make sense of how complex or the complexities that were involved in their homelessness experience. So interviews that we conducted lasted between 1.5 to 2 hours. They were conducted at various locations that were convenient to our participants. For example, some of them were conducted at the transitional shelters, some of them were conducted in their rental flat units and void decks and so on. So that's all for me for now. I will leave you in the hands of Janine, who will tell us more about the profiles of our participants and how shelter provision actually looked like during the pandemic.
Thank you, Harry. I will now take us through the profiles of our participants in this section. So phase 1 actually used a stratified sample of 50 participants recruited across 3 different shelters in Singapore. And their key demographic data like their marital status, age, and family types are shown on the slide. Among the 50, 34 of them were individuals and 16 of them were families. For individuals, their age ranged between 26 and 75 years. All of them were Singaporean citizens, except for 1 permanent resident, and 21 of them had a history of divorce or separation. For our family participants, we had 11 intact families and 5 single-parent families. All families had at least 1 child, and participants were aged between 28 and 81 years. Majority were Singaporeans, except for 9 females, and the majority were married as well. The impact of COVID-19 on homelessness is a key focus in phase 1, and because of that, we use COVID-19 pandemic as a reference point to define homelessness duration. Most of our participants indicated that they had been homeless since before the onset of COVID-19 and its safe management measures. 29 of them had already been homeless before COVID. 8 of them were homeless for less than 5 years before COVID, while 21 of them were homeless for 5 or more than 5 years before COVID. For 21 participants, they had become homeless since COVID. All of our participants had experienced sheltered homelessness for phase 1, because this means that all of them have stayed in a homeless shelter before where we had recruited them. 45 participants had experienced long-term homelessness, and that means that they were homeless for more than 1 year. Additionally, 34 participants had experienced periods of rough sleeping while they were homeless. The rest of our 16 participants had not experienced rough sleeping, but they could have experienced things like couch surfing or could have stayed at their friend's house or other forms of informal temporary accommodations. The majority of our participants, about 38 of them, were staying at a transitional shelter at the point of our interview with them. The remaining 12 participants were discharged from transitional shelter to longer-term housing, such as public rental scheme flats or HDB flats. A significant group of individuals, about 24 of them, among those staying at the transitional shelter, were in the process of applying for public rental scheme. Now I'll move on to share the first part of our findings, that is shelter provision during the COVID-19 pandemic. So with COVID-19 safe management measures, there was a need to promptly provide shelter to homeless people, as well as things like financial assistance and social work intervention to address their long-term housing plans. Shelter capacity was rapidly ramped up to meet their immediate shelter needs. And before the pandemic, 3 transitional shelters were available, and they could shelter 156 families and 60 individuals. Responding to the surge in demand for shelter service though, by May 2020, around 40 temporary shelters, also what Harry mentioned, safe sound sleeping places, with a capacity of 920 sleeping spaces were set up to provide overnight refuge for the homeless. 2 new transitional shelters were also established in 2021 and increased the total shelter capacity to 500 places. By January 2021, around 250 homeless people had reportedly moved from S3Ps to transitional shelters. So there were 2 types of shelters that were provided during the pandemic. The first one, overnight shelters. So these are safe sound sleeping places, or S3Ps as mentioned, and they essentially function as temporary overnight shelter with fixed hours, such as 7 p.m. to 7 a.m., during which homeless people could stay and rest. These places were typically spaces provided by community or religious organizations, such as churches or mosques. For transitional shelters, they provided longer-term accommodation up to 6 months at the first instance, with further extensions allowed if one was assessed to require longer time in terms of securing a stable housing. There was no fixed cap on the length of stay here. Transitional shelters were situated within public housing, such as unoccupied or existing flats. Shelter users shared 1 to 3 room flats and were provided with on-site social work intervention, where underlying issues such as employment, financial, and family issues were addressed. So moving on, I will take us through some photos that could help us visualize what S3Ps and transitional shelters could look like. Through the photos, we hope that you can see how transitional shelters differed from conventional shelters through the use of public housing stock. So here are 2 pictures from 2 different S3Ps. On the left is a space provided by a church, and this photo was taken before the pandemic, as it was one of the first few S3Ps that was set up in Singapore. And the photo on the right was taken at a community organization at the height of the outbreak in March 2020. So the photo on the left shows rolled up mattresses with pillows when not in use, while on the right it shows the beds set up. And as we can see from both photos, S3Ps had an open space living arrangement to accommodate rough sleepers overnight. On this slide are some photos of the pantry and common areas in some of the S3Ps. The photo on the left is food provided by volunteers at a church, and on the right is a sitting area at a S3P set up using the space provided by a government building. In contrast to S3Ps that rely on spaces provided by various organizations, transitional shelters, most of them, not all, use vacant units in various public housing blocks in Singapore. In this slide, you can see some examples of public rental housing blocks with units used as shelter. In other words, these blocks have a mix of units for shelter and public rental housing. The units, as you can see on this slide, are also quite close by to each other, and each unit range from 1 to 3 room flats. Here's an example of a typical layout of the units for families in shelter. 2 families will usually be paired up to share 1 unit, and each family is allocated 1 bedroom. This means that they will have to share 1 kitchen, 1 toilet, and 1 living room. On the right is a photo of the co-living space shared by 2 families. All these furnitures are actually provided by the shelter, and they tend to be donations, so furniture in each unit will vary. Okay, next I'll pass the time to Francesca, who will bring us through our participants' pathways through homelessness.
Thank you, Janine. I'll now share our findings on the trajectories into homelessness. So following the pathways approach in homelessness scholarship, we use the term pathways to describe our participants' trajectories into homelessness and conceptualize these pathways as processes involving intertwining individual and structural factors. In this report for phase 1, we rely on ideal type pathway to give an analytical overview of how our participants became homeless during COVID-19. The term ideal types was first developed and used by a sociologist named Max Weber and refers to analytical models that functions as heuristics for a phenomena. Applied to our study, the pathways constructed in this phase also functions as heuristics. These pathways are only preliminary and will be developed in phase 2 and 3 to gain an in-depth understanding of long-term homelessness. Based on participants' experiences, we have constructed 5 ideal type pathways into homelessness, as can be seen on the slide. So these pathways are the breakdown of cross-border living pathway, the financial shock pathway, and a breakdown of spousal relationships pathway, which is split into relating to divorce and separation and relating to domestic abuse. And finally, we have the multiple incarcerations pathway. Each ideal type pathway is conceptualized around 1 key event that has led to a trajectory into homelessness in participants' lives. So moving on, for the first pathway, we have the breakdown of cross-border living pathway. Cross-border living is a lifestyle in which people commute between neighboring countries frequently for needs such as health, housing, work, and healthcare. So a common example of cross-border living that we might be familiar with is Singaporeans living in JB but frequently commuting to Singapore for work. This pathway centers upon participants' decision to move across the border to neighboring countries such as JB and Batam in search of low-cost housing. In our sample, there are 17 participants, that is 12 individuals and 5 families, that had such a cross-border living arrangement before the pandemic. From the graph, we can see that actually many stressful events had occurred preceding their decision to engage in cross-border living. Events such as divorce, financial setbacks, losing their HDB flat, and being unable to afford open market rentals led to participants facing housing insecurity for years. Having established cross-border living for many years, the border closure during the pandemic was consequential. Many fell into homelessness for the first time. For the next pathway, it was constructed around participants' experience of an abrupt financial shock during COVID. In our sample, 6 participants, there's 3 individuals and 3 families, had reported incurring debt, a loss of income, either through a termination of employment or inability to work due to a health condition during the COVID-19 pandemic. In this pathway, participants typically had long-term open market rental arrangement. The abrupt financial shock leads them to be unable to afford rent, consequentially leading to an eviction during COVID. We will now move on to trajectories conceived around the breakdown of spousal relationships. Breakdown of spousal relationships typically occur as a result of separation or a divorce, as shown in this slide. Participants fall into homelessness as they lack resources to find alternative secure housing arrangements. The majority of participants in our sample had experienced a history of losing home ownership at least once through divorce or separation. In cases of domestic abuse, participants typically have a history of recurring episodes of homelessness. Episodes of homelessness typically flank periods of reconciliation with spouses. In our sample, 4 participants, 1 individual, and 3 families exited their homes due to domestic abuse. Types of abuse reported in our sample included emotional, physical, and sexual abuse. Now, contrasting the linear trajectories of the ideal type pathways, the trajectory into homelessness in the multiple incarceration pathways is cyclical. In our sample, 5 participants have experienced multiple incarcerations. Repeated offenses in our sample relates to drug use and gang-related activities. In this pathway, 4 stresses were prominent: the long-term history of housing insecurity, the breakdown of family, history of income instability, and repeated offenses and multiple incarcerations. In this pathway, multiple incarcerations led to the gradual accumulation of these stresses that contributed to homelessness. While we have presented 5 ideal type pathways into homelessness, there were also other ideal type pathways that we could not fully develop due to the lack of data. Before we move on to the experiences of shelter living, we would like to point out that these are the significant contributing factors to homelessness. First, we excluded poor mental health as there was a lack of participants in our sample that had a history of poor mental health. With only 2 participants, it was difficult to abstract common life events for the construction of an ideal type pathway. In addition, participants faced difficulties recalling life events chronologically and had difficulties in remaining focused throughout the interview. Second, we also excluded a common theme of long-term dependence on family members for housing security. While it surfaced as a contributing factor that led to homelessness, we lacked sufficient data to carve out a unique trajectory. Now I'll pass the time on to Rachel, who will take us through the experiences of shelter living.
Thanks, Fran. I'll now move on to share about participants' experiences of staying in shelters during COVID-19. Overall, shelters were an important source of physical security and function as a transitional space towards participants' long-term housing plans. For our report, we analyzed shelter experiences based on the different needs of individuals and families. However, for this presentation, we will frame these findings in terms of positive experiences and challenges. Here we can see a summary of the key sentiments and themes that emerge. For positive experiences, we will present participants' key sentiments of shelters as a secure and transitional space towards long-term housing. For challenges, we'll cover the following 4 themes: conflicts over daily living habits, loss of privacy, perceived threats to safety, and concerns for children's safety. As mentioned, both individuals and families had positive experiences in shelter. Shelters were an important source of physical security and convenience, especially for rough sleepers. One 66-year-old participant said that having shelter made him feel that he is not homeless anymore. This is because he didn't have to roam around aimlessly thinking of where to sleep for the night. Despite the appreciation for shelter support, families in particular expressed an urgency to move on to longer-term housing. Many family participants shared similar sentiments, as exemplified through this one quote, where one participant shared how she doesn't wish to continue living like this after all, and that she thinks it's better to have her own place. Moving on to challenges faced in shelter, the most significant source of conflict faced by 31 of our participants was the inability to resolve differences related to living habits with other shelter users. These were a key trigger point for many, as they were repetitive in nature. Thus, when it was left unresolved, such conflicts may have escalated into a physical conflict between shelter users. When encountering such conflicts, individuals tended to place a higher demand on shelter staff to step in and mediate. Many of them requested a change of shelter unit or distanced themselves from other co-tenants in order to minimize this conflict. Another point to note is that families did take a more tolerant approach. While the sources of conflicts were similar, families had the distinctive motivation to not escalate conflicts for reasons such as to ensure the safety of their children. In addition, they also had access to social support from within the family to exercise tolerance in the face of such conflicts. Besides that, individuals saw 2 main threats to their safety in shelter. Firstly, substance use in the neighborhood, and second, the occurrence of fights between other shelter users. Fights in these cases were different from physical conflicts over daily living habits. They tended to be more aggravated in nature, and the police were alerted in such cases. These first 2 challenges actually ties to another key theme: families' concerns towards their children's safety in shelter. 3 families expressed this concern, and they cited these reasons. First, that they were worried about leaving their children alone at home with the co-living family, mixed-gendered living arrangements within the shelter unit itself, as well as a general lack of security following incidents of physical assault in the neighborhood. A loss of privacy during shelter stay was felt more prominently by families. Families expressed a heightened awareness of co-living with strangers as they went about their daily lives and tried to cope in various ways, such as intentionally having their meals in their rooms and staying out of the shelter for most of the day. It is unclear what the effects of this loss of privacy is for the family, but the lack of personal space for growing children was especially a key concern for participants. One of the key roles of TS social workers is to assist the shelter user to achieve their long-term housing goals. So one key positive experience for our participants was that their TS social worker guided them through their applications for rental housing. One 58-year-old woman was thankful that her social worker assisted her closely for her entire PRS application. She shared that she only had to provide the necessary documents on her end, and the social worker and staff were doing everything for her. However, one key challenge for some participants was the uncertainty surrounding their application status. This could be due to the lack of feedback and information from HDB, and hence a lack of updates from their social worker. These 3 participants had awaited the outcome of their application for at least 1 year at the time of the interview, and had the expectation that their social worker would be able to provide regular updates. Now I'll hand over the time to Harry to share about our policy recommendations.
Thank you, Rachel. Let's continue the next slide. So we actually have 3 key policy recommendations. I'll talk about the first one first. So the first recommendation that we have is the introduction of a homelessness prevention framework in Singapore. The framework, if I can point your attention to the right side of the slide, consists of 3 key areas: upstream interventions to address homelessness risk factors early. And then the second row, downstream interventions to minimize long-term and recurring episodes of homelessness. And finally, the third one, to improve awareness of available government and community assistance. So let's talk a little bit about upstream intervention first. So the key to upstream intervention is to identify individuals or families who are precariously housed, or what we often say at risk of homelessness as well. So here, the pathways we developed in phase 1 are actually useful starting points. So if you look at the left column, those are the pathways that we kind of developed in phase 1. Our findings show that individuals and families who were precariously housed or at risk of homelessness were typically participants who have engaged in cross-border living. That's the first one, without the financial resources for long-term housing options in Singapore. The second one would be those who were on long-term open market renters, such as PRS, and were vulnerable to abrupt financial shock. The third one, participants on the verge of losing their marital homes because of divorce, separation, without financial resources for alternative housing arrangements. Again, you'll find that actually a lot of all our participants, when they face a housing crisis, the similarity is that they don't really have that alternative housing arrangements. I'll go to the fourth one. Similarly, participants who are at risk of losing access to their homes, either voluntarily or forcefully because of domestic violence. And finally, those who have experienced multiple incarceration, those who had what Francesca earlier said about accompanying stresses, such as the loss of family support, the breakdown of spousal relationship, history of income instability, and housing insecurity. So those are the groups that we propose targeting when looking at precarious people who are at risk of homelessness for now. What about downstream intervention? There are 2 groups that we propose targeting for downstream intervention. First, the sheltered homeless. Here, actually, intervention is about the provision of support to ensure that people stay in shelter, are brief, are non-recurring, and preventing what I think homelessness researchers would call, or even in the literature, what we call the institutional circuit, or some people call it the revolving door, right? Moving from one type of shelter to another type. We see the institutional circuit at work most evidently in our participants from the multiple incarceration pathways. So typically people from a multiple incarceration pathways, they would move from, shelter to shelter. So to prevent recurring sheltered forms of homelessness, we think what is important here is that housing support should go beyond targeting people in the homeless shelter systems and include those discharged from hospitals, those discharged from mental health facilities, halfway houses, the DRCs, the drug rehabilitation centers, and the prison. A tangible intervention then is to help shelter residents resolve their long-term housing issues. This means actually that we have to tackle their eligibility criteria or issues for long-term housing. For example, people who have been debarred from HDB, those on whose divorces have been dragging on, right? Ongoing divorce procedures, unresolved tenancy in another PRS, and so on. And most importantly, to really find ways to reduce these barriers or these constraints to long-term housing in Singapore. Come back to this point later on. Okay, the second group that we propose targeting for downstream intervention are the group I think most of us are familiar with, right? The rough sleepers, or what the literature would call street homelessness. So the focus here, I think we really need to focus on or to target is to reduce the length of long-term homelessness, or to reduce the length of long-term and recurring episodes of rough sleeping. So to be more accurate, it's rough sleeping, by getting our rough sleepers to take up housing assistance. I want to emphasize that prevention here is also about finding solutions for people to stay housed. I always use this example in recent presentations. It's about a homeless person that I spoke to, I think last year, at the end of last year, and even still in contact with him still this year. So I think he got his PRS, his public rental housing, in a joint single scheme in December 2022. So everyone was happy, right? That he was going into a long-term housing. But after a few months, or even less than a few months, we found him sleeping outside again. And we asked him, so what happened? We asked him, what happened? Why are you outside again? And he actually said that he cannot get along with the partner. But then we asked him again, did you not have time to, get to know your partner? And he said, yeah, I got time. We actually had about 7 meetings with the FSC. The FSC actually, facilitated 7 meetings, and I felt that he was okay, at that time. But and it shows us that actually, as the saying goes, right, that the test of the pudding is in the eating, or in this case, actually living together. And we know that this homeless person, or the experiences of this homeless person who came out after his PRS, come back to rough sleeping, is not new in Singapore. Okay, so I sidetrack actually to talk about that story, to specifically show the challenges involved in housing the homeless. But because we know what these challenges are, I think we are also better equipped to develop the solutions. And here, I think it is heartening to see some positive steps that are taken on the ground. Number one, the government's, I think, recent commitment to count the rough sleepers and to take stock of the geographical spread and the hotspots. Number two, the formation of the IPS network is a very important development on the ground, because what it allows then is for different stakeholders, and I think more importantly, I think we're starting to see this in the IPS network as well, for the voices of those with lived experiences of homelessness to be heard. And number three, I think what we see then increasingly also is a demonstration by the government agencies that they are willing to find innovative solutions, if it makes sense, right, to meet the different needs of homeless people. I'm talking here about the launch of the single room shared facilities rental model. So these 3 areas, I think, point to some of the key components of downstream interventions for street homelessness. I think number one, we need ongoing data collection. Number two, we need to collaborate with different voices, right? Not just the voices of the expert, but those with lived experience as well. And number three, we need to increase the housing options for rough sleepers. Right? We shouldn't just say that, they are service resistant, right? We have to give them the options as well. So next slide. So to show how homelessness prevention on the ground looks like, I'm going to be brief because this slide looks a bit daunting. So to show how it looks like on the ground or how it works holistically, I think we use one of our homelessness pathways here as an example, and that's the pathways. The pathways that you see here is those on the breakdown of spousal relationship due to domestic abuse. So where should upstream intervention along this line take place? If you see, I think upstream intervention here could ideally or should ideally occur at the stage where the spousal relationship was already breaking down, right? At the first dot, right? In Singapore, I think what we have currently are things like strengthening families program. You have your FAM and FSC. Those have the capability to support couples facing challenges in their marriage. However, we always say that the key lies in innovative and effective screening tools and the use of admin data, rather than to wait until the couples have the conflict and then voluntarily step forward. This is especially so in the case of domestic abuse, and because we need to do that, then I think it's also important to think beyond our current present infrastructure capabilities. So for example, in Australia, there is a project in Geelong. They use a screening survey with young people in secondary school asking about family violence. Very simple questions, right? And support provided then help the families prevent reaching crisis point. So this little project that they do there in Geelong actually saw a decrease in 40% of youth homelessness. Likewise, in health check in the US, I think, especially, I'll just say, talk about one group with the at-risk groups such as veterans, right? The homelessness screening clinical reminder, which is a tool that they use, ask just two simple questions about homelessness or about homelessness risk, and support referrals will then make accordingly. I think such things could be considered in our system as well. So even at the point, so we're talking about before housing crisis happened, but even at the point of a housing crisis, say when a participant in our studies decide to leave home as a result of domestic abuse, she or he might not immediately sleep outside. That means they don't really immediately go outside, but they tend to seek refuge with friends or relatives. At this stage, right, timely intervention is still possible and is crucial. And social and temporary shelter support provided by organizations, I think that we have like crisis shelters, are key upstream interventions that would prevent the crisis of homelessness, or sorry, the onset of homelessness. What I'm talking about here is about critical time intervention. For example, we need to understand, or we need to find out what is the time frame before people become homeless once they exit their homes in case of domestic abuse. Is it a matter of days? Is it a matter of weeks? The question asked is very easy, right? But the answer is not easy to find. That's why more research is needed. The ability to offer critical time intervention is also very relevant, I think, for all the other pathways. Right? We can ask the same time frame question for many things. What is the time frame before people become homeless once they are discharged from an institution like prison? Like I say, we really need to do more study here. Once homelessness has occurred, and you just follow me down the line here. So once homelessness has occurred, a downstream interventions such as befriending supports provided by outreach groups, referrals to shelters, they become relevant. And the aim of this intervention should be to reduce the homelessness duration and recurrence. It is worth noting, and I'll finish up with this and then move on. It is worth noting, right, that for our participants in a downstream, in a domestic violence pathway, there were instances of reconciliation attempts with the spouse, like what Francesca said earlier on, who perpetuated the violence. So people actually go back to their spouse, right? Just because they experience domestic violence does not mean that they're going to stay away. Some people do go back. Such reconciliation, of course, did not last. And homelessness will occur again once the participants experience another bout of domestic violence. What this shows to us is that there are no predetermined start or end point for upstream or downstream interventions, but rather as and when those interventions are needed. All right, let's move on. Our next second policy recommendation is that if we want to increase or improve uptake of shelter support, we have to understand better why people reject them and incorporate the voices of homeless people or those with lived experience in policy planning. Phase 1 findings actually show that Phase 1 finding shows that participants' reason for rejecting shelter support were contrary to stereotypes of homeless people being choosy or difficult. So instead, our participants' rejection of shelter often reflect underlying needs towards shelter support, such as number 1, suitable sleeping arrangements for families or children, religious considerations, shelter operating hours that were not suitable for participants' work. So let me move on to the next one. This is our last recommendation. So our third policy recommendation is to find ways to reduce the constraints to the PRS for those living in shelters. Our findings show that participants who chose the PRS as their long-term housing plan tended to experience more stresses than the rest. These stresses that they experience on the left-hand side are things like financial struggles, marital conflict, criminal history, mental health issues, and so on. Multiple stresses, or the idea of multiple stresses, often lead to structural and individual constraints, as shown on this slide here, right? So there are some barriers here. Consequently, as a result of this structural and individual constraints, these participants were likely to remain in the shelter system for a long time, moving from shelter to shelter, or experience long-term housing as a result. So you can see some of the constraints that we put on the right column, but I won't go through them because of time. So let's go to the last slide. So for a start, because drawn-out divorces, separations, and unresolved marital flat status were the most common constraints faced by our participants, we propose targeting these circumstances for government agencies to consider if special dispensation could be provided for the following cases. Number 1, shelter users who are separated from their spouse for more than 3 years with unresolved status of marital flat. We use this time frame of 3 years because it is the minimum amount of separation time required before divorce. Shelter users, number 2, shelter users who are in the midst of a drawn-out divorce for more than 3 years with unresolved status of marital flat. And number 3, shelter users who are in the midst of divorce, separation because of domestic violence. And last but not least, shelter users with children in all the above categories. So thank you for your patience. It was a long presentation. We come to the end. So once again, we'd like to thank everyone for their time. We'd like to thank, again, our funders and for SSR for inviting us to this webinar. So we shall take questions and hand the time to Lillian.
Thank you very Janine, Rachel, and Francesca for this presentation. So I'll now hand over the time to Ms. Lillian Ong for the Q&A session with the audience. A gentle reminder for the audience, you may ask questions via 2 ways. One is through the Poll Everywhere link on the Zoom chat. The other way is if you wish to speak up directly, please use the raise hand function and you may unmute and turn on your camera after being called. Please introduce yourself if you wish to ask your questions directly. Sorry, Johnny, could you stop the share screen? Thank you.
Okay. Thank you very much, Zihan, Harry, Janine, Francesca. Yeah, thank you so much for the presentation. Yeah, I'm just looking at the questions that's coming in. I think there is one. Okay, there is one. I mean, there's got quite a bit of a vote. I thought that was actually interesting because it kind of linked a bit to your last point, Harry. It's about it's heart-wrenching to hear that the many challenges living in cold living spaces, especially for the minors? Would there be initiatives to explore safe spaces for children or minors to be placed in supervised care while the parents are at work in the day? If not, are there any current safe spaces for nursing moms?
Okay, so talking about minors, right, and safe spaces. I think this for this question actually hit upon probably the gap for families who are living in shelters at this stage, because as you know that even for families who are living in shelters, when they go to work, then where do their children actually stay? And one of the thing here is that we can consider is, I think, yeah, it really gives us a opportunity to think about how we should actually be providing safe spaces for the children. So at my short answer is, at this moment, I think there is that gap. Where do we leave those children? Because if they stay in the shelter at this moment, I think from what our findings have shown, and I think Rachel, Janine, and Fran, you might come in to share some of the, if you want to share some of the experiences of our participants. At this moment, from our phase 1 study, they tend to stay at the shelter still, and then they rely on other shelter residents to take care of their children and so on. That's why when we report our findings, we say that those in families tend to try to limit or negotiate the conflict that they experience, so that they have good relationship with their flatmates who can then do some of the childcare. But yeah, it's a gap that we need to really consider.
Yeah, thanks, Harry. Maybe I can also just chime in a little bit, because in terms of like shelter, I think what happens is, in the sense that for us in New Hope, we actually work closely with a childcare provider in our neighborhood to actually try to prioritize for the children to really be going to childcare as soon as possible, so that the parents can actually also start to work. But we also know that there are some limitations because of the provision of the hours for such services, and a lot of our clients actually do shift work. So I mean, these are the realities on the ground. Yeah. Okay.
I think this gives us an opportunity to bring in more partners on the ground, actually.
Yeah.
Right. Yeah.
Yes. Okay, I think we have got another one. It's like, how do you tackle people who rough sleep if having constant people conflict is the reason why they can't be with their family or room with strangers?
So if I get this question, how do we help people who are rough sleeping with relationship problems, right? So especially those who don't have good relationships with their family. I think one of the key one of the key characteristics, wouldn't say one of the key challenges that rough sleepers do face is that they often face what we call homelessness don't occur because of a certain reason. Let's just be clear, right? It's not because you quarrel with your family or you have poor relationship with your family, then you become homeless, because it does not explain why one person who have conflicts with their family, why they can stay house, and it does not explain why the other person will go out, right? I think what we can safely say here is that when people do become homeless, they have to, it's through a process of losing the resources. One of these resources, of course, is your relationship with your family, right? Because if you don't have good relationship, they might not want to house you. So why do people then lose resources over here? I think it's also, to a certain extent, if we look through their life, there would be things that happen that cause conflict. So how do we help, and how do we tackle this issue? If possible, I think what many shelters would do, or what many service providers or even outreach group would try to do, is to see whether reconciliation is possible. But before you talk about reconciliation, sometimes you need to work with the homeless person to also tackle the issues as to why, or even get them to trust you, to build that trust so that they can tell you why certain things happen at home first, because otherwise you won't know the head or the tail, then you don't know how to help as well. So reconciliation is possible. We have a few cases where we actually were able to reconcile them with their families. The gap I would say here is sustained support. Even if you have reconciled a person with their family, you can't guarantee that the next time round when another thing happens, the conflict will not happen again, right? So that's one thing. But for many Ralph sleepers, long-term Ralph sleepers especially, actually there's nothing to record. I mean, to put it bluntly, they have lost contact with their family already, meaning you don't even know where to go and find their families to reconcile them. So this is where I think the next step to tackle this issue is to then build the networks that are important for this person, right? To rebuild the networks so that they don't remain isolated on the ground. So that's my answer.
Yeah. Thanks, Harry. I think it's really very important, the part where you mentioned about reconciliation and to work with the homeless individual and also for sustained support. And I think the support is not just during the stay in the shelter, but also when they moved out of the shelter, how are they being supported? I mean, in our work in New Hope, in the shelters, what happens in the sense that we do try to exit our clients when they move out to the joint single scheme. We do try to refer them to the FSC nearby. But what happens sometimes is that they feel that they're so happy about having their new home. They are like, I can cope with everything right now, things are doing well. But we know that it's really about sustainability and also keeping our eyes on them. So, I mean, we do try to support them for as long as even 6 months or 9 months for some cases. But I think it's more of the vulnerability that they tend to hold or position themselves because of some of the issues that they have in terms of the lack of relationships. I think there is one question. It's actually about elderly. I thought that any insights on elderly homeless individuals? It talks about shelter does not accept seniors who are frail and in need of assistance for their daily living. Any thoughts on that?
I don't quite get the question. What is the question? Insights on elderly homeless. Okay, I think I can comment a little bit on older homelessness because I did that work quite early on. So I would say that when I was doing, my PhD when I was doing this was actually the research on older homelessness in Singapore. That talks about, so by older homelessness, we actually, in homelessness scholars often call, 50 years and above older homeless people already. Why 50 years? Because they tend to think, we tend to think that, after 50 years old, most of the people, there are two things, right? Number one, people tend to, the health and tend to decline. And then for many people, sometimes it's harder and harder to get jobs if you lose your jobs around that age. And don't forget that many homeless people are not as don't have the kind of educational qualifications that many people have, right? Some of so for older homeless people that we are looking at, the one point that I want people to think about is actually think about, don't just think about now. That older homelessness is a reflection of things that have taken place in the past. Those for a person who was 60 over years old, 70 over years old, they grew up in a time, right, where maybe education was not so important. Not so available as well. Many people, if you are living in the 50s and the 60s, it's quite common, for people to drop out of school early, especially if you come from a lower income family, right? You have to go and help your parents to go and work and so on. So actually, that's why we see in terms of the older homeless people, actually many of them tell us that, hey, I drop out in school at primary school, secondary school. And then a lot of times because of this, then what happens is it has effect on their jobs and so on that they take on, and the ability to save. So that's one thing. The other thing about older homeless people that I found is a lot of our older homeless people that are sleeping outside. What I found is that there are three areas that they're very weak at. Typically, they tend to have already lost the ability to gain resources through work. Some of them are still working, but because of the deteriorating health, they don't have this constant source of income. Number two, they have also lost what we call family support, right? Because either they, had conflict with their families. I mean, Fran talked about this earlier on through some of the pathways, marital conflict, divorces, and then of course some people also lost support from the extended family. Right? Sometimes people quarrel because they sell the house, and then the siblings don't ever talk to each other ever again. And lastly, they either don't know where to find help. They have a stereotype of the help that's available. They're quite scared of some of the shelters. There's a stigma there. Or some of them don't qualify because of various bureaucratic reasons. So once these three components set in, it's quite tough, right? When you don't have the ability to work, when you don't really have support from your families and friends, and then when you don't find yourself, qualifying for government, or you don't know where to find, it's quite tough.
Yeah. Thanks, Harry. I think it's also kind of like likened to the part in terms of like they have increased independence rather than increase in independence for them, for this group of elderly homeless individuals. What I'm also thinking is that, because early on you were actually talking about increasing the variety of housing options. Maybe it's also to increase the kind of options that they can have, whether is it community care or is it senior group homes for them. For some of them, they can still thrive in the community. They do not need nursing home, but they just need more supported kind of help to assist them. There is actually also a question about the research, is that, are we considering, are you guys considering, extending this research to include the shelter workers' perspective? Yeah, or maybe the S3P providers' perspective. Yeah.
If we get the funding, yes, we will happily extend the research and do more about shelter. But that's a good point, because I think it's not just important to get those with lived experience, but also those who are actually working with homeless people as well. So it actually gives us then a very holistic view of the entire ecosystem. But yeah.
Okay, great. So I'm hearing that it's like, the team is ready to go and open to it. So it's more like funding. What about we have another question, is about how many rough sleepers were identified as stateless? No Singapore citizenship or PRs, without the Singapore citizenship.
I don't think it is a lot, but I'll give this question to I think one of either Fran or Janine or Rachel, because they are quite. I think they mentioned one or two cases to me, but maybe one of you could come in and give an example of those who are stateless. Yeah.
Yeah, I think in our study itself, there isn't anyone that is stateless per se, but as I presented earlier, most of our participants are actually Singaporean citizens, Singapore citizens, with the exceptions of so we have what we call the transnational family. So some of their spouses are actually so they do not hold a citizenship here, so they are either on long-term visit pass or on dependent pass. So yeah, there are, I guess, certain barriers tied to their citizenship status as well in terms of housing. But other than that, yeah, nothing much to add. Yeah.
Not for phase one.
Yep, not for phase one.
Okay, I'm hearing that this particular research has got different phases. Right. How many phases is there?
We have 3 phases, but actually phase 2 and 3 are interlinked. So phase one actually focuses on the COVID situation and shelter situation during COVID. Phase two and three is more about our attempt to look at long-term homelessness. What does it look like? And then also our attempt to look at solutions for long-term homelessness as well. Yeah.
Is there any time frame in terms of when this research for phase 2 and 3 will be completed? Yeah.
Fingers crossed it will be completed by the mid of next year.
Okay. Okay.
Yeah.
We look forward to that. Okay, there is a question about usually patients with history of substance abuse have issues getting shelter. Are there agencies at the moment advocating or providing for their shelter needs that is non-discriminatory, non-judgmental, and takes a harm reduction approach? Yeah.
Maybe Lilian, you can come in later on to chime in as well. But for me, at this, what I know at the current moment is that there is really not really any targeted agencies that are looking at those with substance addiction or sheltering those with substance addiction specifically at this moment that I know of. That's not to say that there's none in the pipeline. But the thing is, I think that often when we go into, we talk about the homelessness link forum that's coming up, right? So we have actually talked about this issue quite a bit last year as well, that among the people, the partners in the peers network, we realized that this is indeed the gap itself. How do we better house those with substance addiction, those with poor mental health, and so on? So I think the short answer is at this moment, no, but the network itself is, and even researchers like ourselves, we are working very hard at trying to find a solution for this, and also how to do that. As for the harm reduction approach, I think the answer is we're still working on that as well.
Yeah. I think for in this area, I think the anxiety, however, it's more of like the understanding and whether how equipped are we in terms of like the staff and the understanding of what would be the best way forward in terms of the model. But generally, they are all accepted into the transitional shelters if there is a need for them. Yeah. For them to actually have housing. Yeah, so there is nothing like, because of they have been incarcerated in the past because of substance abuse, that we can't take them in a transitional shelter. But I think what happens in the sense that, because the question is about history, but are they still active substance abuser, So that is the other challenging part in terms of how do we deal with it. Yeah. So I think we probably need a bit more equipping and all understanding, and it's got also to be a shared kind of understanding in terms of the model. Okay.
Right.
Yeah. Next. Okay. How can community social workers, example from the FSC, help in tackling homelessness in Singapore? Maybe any of our fellow researchers? Yeah.
So you're not asking me. Great.
Yes. I think we should let Janelle or Francesca help in also. Yeah.
Yeah. They're deciding between themselves, sending signals.
Yeah, I think Rachel actually briefly mentioned like the role of TS social worker, like just now on like about housing assistance. I think with regards to like community social worker, like the SSD, how they can help, right, to tackle homelessness. I think they provide a very important support that our homelessness friends would need in terms of for example, settling the other daily needs in their lives. Things like they need help with certain issues, applying for a job, or be it like certain I would think like more administrative, bureaucratic stuff that they need help with applying, maybe. I think aside from that, I think this is what came out from some stories that I've heard from our participants as well, how they have a relationship with their social workers, and how sometimes their social worker, right, can be that person that help to bring them or help facilitate their entry into like longer term housing as well. So I think they have a role to play, and I mean it is similar to how the TS social worker works as well. Yeah, that's my take.
It really sounds as if it's really all hands on deck, at every time, and at different juncture. Yeah. Thanks. I'm also thinking that it's also about maybe to recognize some of the red flags. Like early on, you guys were talking about those who are divorced or those who are already couch surfing, with very precarious housing, while staying in very precarious housing spaces, like staying with friends or just relatives, not homeowners. I think these are some red flags that as a community we can all look out for them. Okay.
Maybe I'll add on one thing that just came to mind. I think also from a conversation that we kind of had earlier, I think also it's about the caseload, right? I mean, of social workers. Sometimes, at the end of the day, a social worker can only handle so many, right? So if you overload a social worker, then the help rendered will be reduced. Right? So that's something I think that is important for us to consider, because if you want to help homeless people, I think one of our articles that we publish in I think our opinion piece that we write about is not just a few months kind of effort, but it's a very prolonged effort that goes on for years, right? So that commitment level is also something that is a challenge. Yeah.
Yes, or else, right? I think if because homelessness is actually a very complex issue, and if we just want to look at it on a very surface, it could actually really, at the end of the day, just really a change of address. And I think one of the vulnerabilities is that that our clients will actually be going through the revolving door, going to JSS, and after a few months, where are they at? So are they really picking up the life skills to really resolve and work through some of the underlying issues? Yeah. Okay, I think this is quite a good question. It's also a bit tied down to what's happening in the recent years. Is high costs of housing one of the main reasons of homelessness? If so, will decreasing the general cost of housing a viable solution to decrease the rate of homelessness? Yeah.
High cost of housing. This is a very challenging question. I would say that yes, the cost of housing is a factor. I mean, obviously, if you look at research around the world, when we talk about homelessness, one of the structural factors that researchers always surface is this point, right? The lack of affordable housing. That said, you see, the issue about the cost of housing in Singapore is something that is quite it's quite different also, because we also know that actually it is not just about the cost of housing, because if you are a low income family, then there are subsidies available. I mean, we have subsidies available, right? So you can actually afford housing. I think the key here is not so much, I mean, cost is one thing, but also our housing is tied to some various policies as well, isn't it? One of the things is actually it's a challenge if you are unable to work, right? You need your CPF. So this ability to work, to maintain that is something that we need to think about. The other thing here is, I guess, if we really look at the housing issue here, then housing is also closely tied to, and this, when we talk about this overseas with some other researchers as well, they often remind us that, hey, your Singapore housing is tied to family as well. So, right, so things like that for singles. So I guess there are some things that are announced, I mean, by PM speech and all this, that they're actually looking into a lot of these issues as well. So I think the government is aware of that. But yeah, I mean, the short answer is yes, to a certain extent, affordable housing is important, but do remember that there are subsidies available as well. And there are other issues that we should look out for.
Yeah, Harry, you mentioned about CPF and things like that, statements, because I'm also thinking about the recent trend of gig economy. Do they have CPF statements also? Yeah, so I think that's something that we really have to think hard about it because of the trends. Okay, let me see. Maybe just one final question. I thought this is actually quite interesting also. It's actually about for the young adults aged 21 to 25 who are rough sleeping, okay? Because the shelter is actually a very dynamic environment to transit into for young adults who are between 21 to 25 years old. And there are actually very limited spaces for them. So what are the options for these young people?
Well, you see, I hesitate because again, all these questions are very smart. They hit upon all the gaps that we are currently facing. So I think for 21 to 25, there are a few points that I can talk about here. Actually, 21 to 25, we seldom see rough sleepers, to be honest. At that stage where for youth homelessness in Singapore, a lot of this phenomenon of youth homelessness tend to be not visible because they often couch surf. That means they go and stay at their friend's house. They move from one friend's house to another friend's house. That said, of course, there are some that we see on the ground as well. I mean, a few cases that we see on the ground. As for shelter provision at this age, I think at this moment, the shelter doesn't accept them, right? So Lillian, you might want to come in. Because from our knowledge is 35 years and above to go into a TS. And then where can they go? I think HDB often tell us that it is on a case-by-case basis. They can go for a public rental flat, but that's a case-by-case basis. So I'm sure if you come from if you present your case to HDB for their consideration, that I think is one avenue. Another avenue that recently emerged, but I think this is not very, it really depends on who is opening up the houses, is the open home network. So we do have that now. I think that has the most potential for housing these young people, because then you provided that, that we have enough people who wants to host. So that's another way. But yep, I would say that there is a gap at the current shelter system. Yeah.
So for the shelters right now, we do accept folks who are above 21 years old. So long as they're above 21 years old, the shelter could actually consider them. But like what Harry mentioned, usually at this stage, they usually have quite a bit of social network still. Okay, they still have relationships, so they could actually still couch surf. In fact, some of them may actually, just come into the shelter for a few weeks, and after that, they feel that, I don't really like the environment. I don't want to be hanging out with all these old elderly uncles. They may just then leave the shelter, and back on the streets, or maybe couch surfing again with their friends. Yeah, so I think on the other part of it, in terms of like getting their rental flat, it's really about appealing to HDB with whatever circumstance or family situation that they're in, to actually put up work with a social worker to actually put up an appeal for them. Yeah. Okay. Yeah, I think there's still a lot of questions, but I think we don't have enough time. But I really want to kind of just want to thank Harry, Rachel, Francesca, Janine, for your presentation, because I think it's really been very engaging and fruitful. We look forward to phase 2 and phase 3 as well. Yeah, your findings. And I also want to encourage the participants, if you are available on the 10th of October, do join us at our homelessness. Okay, we'll get Zhihan come back in. Okay.
Right. Thank you, Lillian, for moderating this session as well as for your insights. So I'll quickly launch a Zoom poll for our audience. Yeah, just a quick question. Please let us know your feedback for today's webinar. And I'll also go back to the slide on the Homelessness Learning Forum. So if you are interested, do scan the QR code to find out more or to register for the event. Yeah, and okay, I'll just leave the slide on for a few more seconds. Okay, And one more announcement that we have is this is an overview of SSR seminars for the rest of this year. So our next seminar is on child development accounts by Professor Michael Sheridan. So if you're not already on our mailing list, do scan the QR code on the screen to join our mailing list to receive updates on our upcoming seminars and other workshops and events as well. So with that, I'll like to thank the speakers from IPS, Harry, Rachel, Francesca, and Janine, as well as Lillian again for your time for this seminar today, and also for everyone who, all of our audience who have spent their time with us at this session. So with that, I will end this webinar. Thank you so much, everyone. Yeah, I'll go back to the slide on the Homelessness Learning Forum for anyone who didn't manage to capture the information. Yeah, but please feel free to leave this session. Thank you so much.